Hey, discerning listeners, we have a special guest with us on the podcast, Kimberly Bartlett, here to talk about play therapy, something that is very near and dear to my heart that I don't get to talk about very often. And I think is important, of course, for clinicians that work with kids to understand, but also I think for parents and all of us, really, because I think the principles can apply to adult life activities. So welcome to the podcast, Kimberly.
Thank you, Kirk. It's a pleasure to be here. Excited to chat about, play therapy.
Yeah. So you work from an office on Aurora on Highway 99, which is that way. I'm pointing east, I guess, little southeast from here. And I drive by your office all the time, as most people that live in North Seattle probably do.
Right.
And never realized it until I looked up your office location. I'm like, oh, that's what's in that building. Let's start from the beginning.
Sure.
What do you do? Paint a picture for the listeners regarding play therapy. What does it look like, and what are your objectives with kids when you're doing it?
Yeah. Well, I'm on the floor a lot when it comes to play therapy. So play therapy really is about giving kids an opportunity to express what's happening inside their world, their experiences, in a way that is developmentally appropriate. So those toys really end up being words that registered play therapists interpret and get a better picture of what's going on inside. And it also helps kids feel a little emotional distancing that makes it more comfortable for them to express what's going on inside, instead of just having to come in on the couch and, Kimberly, this is the worst thing ever, and this is what's going on, and they're just not there. So we ultimately do that by inviting them into the playroom and giving them the playroom and then guiding them through, depending on if we're doing the treatment or the assessment, we may use some different strategies to do that.
Yeah, like a classic example is you have a death in the family, maybe a parent or a grandparent or a sibling, and the parents will bring the kids in or a child in because they're concerned, whether it's just they're worried about their kid or they've seen some behavioral changes, some emotional issues, and so they are wise to bring the child in. And what is in their mind often for parents is that we're going to sit them down like traditional talk therapy, and we'll say, tell me about your emotions, please. And the 4-year-old will be like, well, let me tell you, Dr. Honda, I've been really having some ups and downs lately, and that's just not possible. Even for tweens who might possibly be able to have this conversation. It's too scary. And children mainly are not used to being asked these questions. They don't see these kind of conversations. Whereas they do play, hopefully. And there's a lot that goes on in play. If you've ever seen children, you will, if you paid attention, you'll see them have grand, epic, emotional story adventures. You know what I mean? So that's why play is used in therapy. So what kind of activities, if a parent were to watch this happen, which I'm guessing sometimes the parents are in the room.
Yeah, sometimes they are.
Yeah. What would they see exactly?
Yeah, they may see their child playing and it looks a lot like what they normally do. It could look like that for them. It could also look completely different and scary for a parent. Sometimes it's a little bit harder for parents because the child is letting out what they don't usually show, right? And so if they can get into a safe place, if they feel like this is their place where they're not being observed by their family or having their parent worry about how worried they are, because sometimes these littles don't want to upset their parents. So if they were a fly on the wall, so to speak, they could see that range. But ultimately, it's getting down, playing a lot what they usually do. It may be sword fighting, it may be in the dollhouse, maybe making activities with our hands. So it looks a lot like just play, right? But what's really happening is so much more than that. And so the role of the registered play therapist is to help the parent understand what is happening, right? Not necessarily every detail step by step such that we break the confidentiality of the child, but enough to give, hey, these are the things that are actually happening when they're doing this, because it'll look like to a parent just to play.
Yeah.
So yeah, that's kind of maybe what they would see and kind of how we would help them understand what they're seeing.
Do you ever get pushback from parents saying, what are we doing here? We're here to talk about X, Y, and Z. Like another problem that parents will bring their kids in is if the kid is getting in trouble at home or in school a lot, and it's kind of a crisis that's immediate.
Yeah.
And for the first 8 weeks, they don't see any changes, and they're watching you, and it might even look like you're indulging their problem because you're playing with them, you're rewarding their bad behavior. Yeah. Do you ever get pushback like that?
Definitely. And that's really my job, is to help educate the parent, that they're understanding what's happening, what's the clinical work being done when they see play happening, to help them understand the principles, the values. And if that's not being explained well enough, then there is a pullout, understandably. And sometimes it's a mismatch of, I guess I'm looking for the word, perspectives, philosophies, maybe. I think when there's a difference in philosophies, then it's going to be hard for parents and therapists to come together around that. So again, providing enough information so that the parent can either make a switch and try to understand the clinical value of play therapy and what's happening. My job to explain it, up to them if that feels like a fit. Sometimes it does and sometimes it doesn't. And so I try to be very transparent from the very get-go. Hey, this is my approach. These are my philosophies. These are the schools of thought that I utilize in my approach, and here's my approach. I think the earlier on we can figure out if we're a match, the better. I'd rather them go somewhere else where they feel like it's a better match for them. But you're probably going to find pretty similar general approaches. So sometimes it takes more than one shot with a therapist to say, oh, I guess there is some value here. There's some difference than the, schools of thought that I was raised with.
Yeah. I can't imagine an alternative, generally speaking, to the model that would be viable with a child, particularly of a certain age. Maybe they're not into your particular style or your particular way, but if the parent is looking for sit down and confront or sit down and talk about emotions directly, even if they did find a therapist that would do that kind of work, they would find that it wouldn't work very well. The
Agreed.
Kids would clam up.
Yep.
They would not want to go to therapy.
Yes.
For me, I started out in the mid-90s, and as a marriage and family therapist would get referred kids as a part of my overall referral base.
Yeah.
I probably had, a third to a quarter of my clients in the first 10 years would be kids younger than 12.
Yeah.
As young as 2 sometimes, but, I think generally speaking, it would be, 5 to 12, that kind of thing. And of course, I had a lot of teenagers as well and a lot of adults. But with the kids that I worked with, I gravitated towards play. I wasn't trained. I'm not registered as a play therapist and had never taken a class. I don't even, in fact, there wasn't one offered in my university. We eventually, as a professor at Antioch, we pushed to add play therapy, and then eventually we have a certification program at Antioch in the marriage and family therapy program, which makes a lot of sense. But anyway, when I started out, I just heard about play and had read some articles and had some very minimal guidance and supervision. But trial by fire, I just eventually landed on a particular approach over time, which I would later learn has some similarities to particular, in the same way that individual therapy, you have humanistic and psychodynamic and narrative and, all the different schools of psychotherapy. They also are within the different play therapies.
Yes.
You have different modalities, different mindsets, different hopes or different objectives. And my version was that I found that with kids, there were 2 main reasons to use play. One is you just want the therapy to not be a horrifying terrifying
Yes.
like experience for them, because so many kids, and teens included, would be just terrified, just wide-eyed. What am I doing here? I'm at the doctor's. What's happening? And to have play, whether it's Legos or a board game or throwing the ball or puppets or whatever, running in circles, or paints or, all those kinds of things. Kids are like, okay, I've done this before. I don't know what's going on here, but okay, I can hand paint. We'll see what's going on. Oh, okay, this isn't so bad. And in the beginning of the first phase, play, I would use this, not uniquely, as a way to have kids at least come to the next session.
Yeah, be comfortable, right?
Yeah, just make it so it's not a horrific experience for them. Then I found that the material, I'd often be given a presenting problem by the parents, because, the 6-year-old isn't saying, I want help with X, Y, and Z. I mean, very rarely they would, but it's typically parents that would say, here's the concern. And so I would enter into their world. I would figure out their vocabulary, because every kid has their own world, their own vocabulary, their own syntax regarding their play, and I would have to intuit. I couldn't ask the kid, so when you do that with the dinosaur, when it attacks like Woody from Pixar, is that your dad? Like what? I can't ask them that, because they don't
shut
even
down.
know.
They would shut down.
Well,
for
shut
sure.
down, but they don't even really know what I'm saying, because when kids play, and hopefully when everyone plays, they lose themselves. It's like the analogous experience for me today is, this is all getting somewhere, Kimberly. So
I'm in for it.
is that when I'm watching a movie and I'm really into it, I will leave the movie theater realizing later that I had forgotten who I was and where I was. I was just in that
That's
world.
a good one.
And so when people play, ideally in a certain mode, that's what they're doing. They're not thinking, okay, I'm going to use this dinosaur because the plot is this. It's just like I am the dinosaur, and this is Woody, and they've lost themselves,
they're immersed.
or they're manifesting parts of themselves freely, free associatively.
Yes.
And so I, over time, learned, because in the beginning I would try to lock it down, because I'm being given this mandate by the parents. So I'd be like really trying to, so what's going on? Okay, so tell me about your dad. And the kid would be like, and so eventually I just like, that's not working. So I would just say, okay, just throw that all away, diplomatically explain the process to the parents, get them on board, and explain it takes a long time, and da-da-da. Then just put that aside and just enter the world, because, maybe there's some other issue going on. And then I would just get this, it was a guess, but it was some sense of the emotional themes and the behavioral themes. Like when we look at kids playing violently, like it'd be a kid, dinosaur eating Woody, our interpretation, a very ham-fisted interpretation, is like, oh, he has violent tendencies. He wants to kill someone, or he wants to get revenge. But the landscape might be completely different, And if I enter the language and the play, and if I can get involved somehow, like I become a third character, like I'm this other character with Woody and with the dinosaur, and that's a whole thing too. It was just like, how do I get the kid to let me in, And some kids would be like dying, like, please interact with me, but other kids would really, So it's like, how do you navigate that? The whole time I'm just like, put your agenda aside and just like enter the world and see what happens. And then it could be 6, 12, 18 months later before I even have an inkling as to what emotionally is playing itself out. Then I assess, then I begin to figure out, okay, what's going on with this kid emotionally, and what are the concerns, what seem to be the aggravations to their personality and their safety and their identity and their life that's being expressed, because kids would often play in a repetitive theme way. Mm-hmm. They tend to want to do these things often,
Right.
And I would eventually get a sense of that through the play. That's the assessment phase. I'd be incorporating what I'd be getting from the parents. And then I would say, okay, in their world, and I'm doing this movement right now because it's so amorphous, but it's you just have to let it affect you. And then I would enter the world and I'd say, okay, what I think is happening is the dinosaur represents this kid's agency, and the agency is it's satisfying to the kid. This is sort of a simplistic way, but the kid wants to have agency, and so this dinosaur is a representation of that agency that wants to be expressed in his in his life. So how can I get that dinosaur to have agency over my character? and have that be a safe thing without it causing harm to other people and retaliation from other people or wanting to balance the scales all the time, But I would just feel that, and I'd have to go a lot on faith, because I can't ask him, is this what it has to do with, the way that I could with an adult? So that's just kind of one area, but that was a pretty common area that I would fall into. As a legit registered play therapist, am I completely off my rocker?
I definitely feel the same along the lines of feeling immersed and being able to have a greater sense of trying to understand in ways that are sometimes hard to articulate. And I can definitely feel that same thing as well. Because there is a difference, because we're not always using words, right? There isn't the filter as adults that we use to think through, and what do I say and how do I want to say it, and now here you go. That kind of process that's natural in the play can sometimes be hard to follow. I think the beauty of the higher training and education around the play helps to reduce some of that timing. That 6 to 18 to 20 months of trying to understand, I think, ends up being more helpful, because you're having some more specific strategies and tools to be able to really interpret faster, ultimately, right? But there is still this sense of vagueness, right? We definitely do themes, like you said. We're looking for, what are the things that I'm consistently seeing? That repetitive play. Are they completely just lost and immersed and sometimes go silent? Or, right, like those are our cues. And so we train to what are the cues, so we can more specifically, you did it, right? It just was this longer process of getting there. Whereas having some of these that we know what we're looking for and have a particular way of tracking them, so we can say, oh, I keep seeing this theme. Even though it may play out in different ways, I'm seeing the theme. And what does that mean for this child? And we interpret that, and we interpret it in relation to the information we're getting from the outside. Schools, parents, etc., that help give us a lens to interpret some of this. So, yes and no, I guess, would be the short of it. But the themes are particularly important, and hopefully that time frame shortens and helps us to explain things. And I find in the assessment process, having some additional data really helps in that, interpretation, whether that is, some forms, some additional things, some testing that we do to help support some of the interpretive piece as well.
Do you have any interpretive measures, like the house drawing thing? What's, the house tree person?
Yes, house tree person,
Yeah.
The kinetic family drawing. Yes,
Can you tell us
definitely
about those measures? Those are kind of interesting.
Yeah, those are fun, for sure. Again, you have to be more trained in a lot of the art interpretation aspect of play therapy, because really we kind of have a range of tools and expressive therapies, including expressive therapy assessment strategies. So some have that training, some don't. I think it's only really useful if you really do. Otherwise, you can utilize that as, how are they in being able to have a request, right? We can interpret, it becomes more that than the actual drawing. But yes, house, tree, person is a fun one. This is just really about their selves, how they see themselves in their world. Same with kinetic family drawing, which I kind of like a little bit more.
What does that look like?
Draw a picture of your family. Everybody's doing something. They don't have to do the same thing is kind of the directive.
And with house, tree, person, you just ask them, draw a house, draw a tree, and draw a person.
Yes. And draw it any way you want.
And how do you avoid the pitfalls of projecting and reading into these measures or play, inserting your own notions of what that is?
For me, I utilize questioning in a particular way that helps them feel not invaded, but at the same time gives them opportunity to dialogue. Some kids are ready, and especially in my assessment process, I do much more of that because I'm assessing which type of play therapy approach is going to be best for this child. As an integrative play therapist, I don't have a one-size-fits-all model. I don't use the same play therapy strategy. So part of my assessment is this kid more interested in doing these aspects? At what point are they at and been able to receive treatment? So I'll ask those kinds of questions. Tell me about the picture. I'll ask them, what would daddy say to mommy in this picture? How is this person over here feeling in this picture? So I give them some opportunity to still have the distancing with utilizing the picture itself rather than you. What does dad tell you? It's the picture. So there's still that distancing that we like to provide in play therapy, but it gives an opportunity. If the kid's like, I don't know, it shuts down, you're like, cool, not this.
Yeah.
But other times you get more.
Too vulnerable, too upfront.
Absolutely.
Too early, maybe.
Yes.
Yeah. The kind of classic example of this is you ask a kid to draw their family and dad is on the other side of the paper or something.
Sure.
And there's this knee-jerk reaction from people to say, well, that clearly means that dad is distant or the kid's trying to distance themselves from dad. And then you enter the world and you ask questions and the kids just they indicate that it's some other reason why they have dad over there. It's not because they want dad
it could be.
to be away from them. It's just they ran out of space or they just like to use both sides of the paper or
right.
If you didn't stop them, they would have put themselves next to dad on the other side of the paper, but because you draw the session was running out. So
absolutely.
You just don't know. It's like dream interpretation. It's like I was flying. Oh, well, that clearly means X, Y, and Z.
Right. It can't be.
Yeah.
Yeah, absolutely.
So with play and with art, you can't just interpret based on crude interpretations
absolutely.
Of your own notions of what that
especially.
means.
And especially a one time only, right? It was that one day. And so that's where we look for specifically in play therapy, a lot of patterns and themes because maybe it was just that day because there is so much interpretation, right? So like you're saying, well, there might have been a reason I didn't put dad next to me in that one, right? Like, let's talk about it. Tell me about it. You have to give that opportunity. And then do we see that in other ways? So that dad on the other side of the page that he says, I don't know why I put him there. And the play continues to show dad as a distanced character. Now we can kind of put those pieces together, right? But on its own, like you're saying, it's not valuable. Right? You just that one-time picture. What does that mean? That's not valuable.
Right.
And sometimes, unfortunately, therapists early on in their career sometimes take that as gold, right? Like that is fact. According to this book, it is that. And it's just not enough.
There aren't legit books that do that, are there?
Do what? Interpret art therapy?
Yeah.
Oh, there's definitely art therapy interpretation. But the idea is...
Not legit books, right? Because all the art therapists that I know will say that's ridiculous, that you can't just say X equals Y.
Agreed. It can't be a one-time only. But if you're really thinking about psychoanalytic, Jungian, you're going to have symbols mean things. So art therapy really, and I'm not an art therapist, I'm an expressive arts therapist, but I'm not an arts therapist. There are some symbolism that you can take out. But again, we don't want to take that on as a one-time only. It has to mean this, right? Again, we're looking for those patterns. Does, in this example, dad continue to be away from the family? Mm-hmm. And what does that mean? Mm-hmm. Maybe that's, and sometimes it comes up, and then you're drawing it together. I'm really sad that daddy is at work all the time. Mm-hmm. And now we're like, the picture of dad on the other side of the paper. Dad not being in the dollhouse and everyone else is, right? Now it's starting to come together.
Yeah. Or the kid is trying to protect dad from abuse from the mom and is putting the dad on the other side because he wants to section him off, get him away, give him some relief, or, who knows? Or, like I said, he just ran out of time and was going to do other things on the back of the page, like put flowers on the back. I don't know, who knows? But yeah. So it sounds like the way that you operate, I heard some things earlier, is to at least attempt to be more quick about things, more to at least have an aspiration for it not to last years and years, the way that I was talking about earlier.
Right.
Is that what I'm hearing?
Yeah, I mean, that definitely. My goal is always to help the family get to an equilibrium that feels good. And that's not always this fantastical beauty or way, rather, of seeing things. It doesn't have to be this fantastical life, but it's something that feels manageable. So we're from the very beginning talking about how do we get you there as a family and continue without me. So with that, it's not time limited, but the goal is always to try to exit, right? The goal is always to how do I get the family to continue with the new skills that they've developed and be able to maintain them without me. So I guess in that way, I'm always thinking of how do I get them to that point so I can be out?
So what would be a typical course of play therapy for a kid that comes to you?
So research shows that 24 sessions is the average.
Okay.
So that's the overall average for everybody, all different play therapy approaches. 24 sessions is average. That's from a kid who just is struggling because they moved houses to someone who's been abused. So that's the research average is 24 sessions for play therapy.
Mm-hmm. Do you ever get asked to figure out if the kid has been abused or not?
I tell them right up front, this is not a forensic interview. We don't do forensic work here. The nature of the work is confidential. So yes, I've been asked that. And I don't take those clients on, and I try to help them understand the difference and kind of where to go next.
Yeah, that's great, because a lot of people who treat children will be asked this question. There will be, it's often during a custody battle, but it could be a lot of other things. And a parent brings in a kid and says, I suspect that this kid has been abused outside of my awareness, maybe sexually abused, and I want to know. It's natural. It's good that a parent would want to know that. Sometimes they're looking for dirt to take custody away from the other parent. And that is that's a different profession. That's a forensic evaluation.
Yep.
And it is ethically, it can't be provided at the same time of treatment. You're either doing assessments or treatment. You can't do both for a lot of reasons. So, yeah. I'm glad that, and I would expect nothing else, Kimberly, but
yeah, that is one that definitely does come up, and that is sad. And sometimes I see kids where the parents are like, "We're not asking you to ask, we're not asking you to find out. We just want you to know there might be something there." Yeah. And then that's different. And then we talk about again the limitations.
Now, can we learn things? Can a child divulge or tell us? That absolutely does happen. Mom is abusing me at home, or someone is touching me at school. Yep. Those things do happen, but it's in the course of providing treatment, in the course of helping them that a disclosure is made. We're not trying to determine whether or not something happened or not. And we also will state it as such in the record. And if people ask us, we'll say, I didn't forensically evaluate, but here's what the child said to me. Absolutely. I can't say whether or not it's true or not. I'm just telling you what I was told. In our heads, clinically, we believe the kid because if it's credible and there's no reason to doubt the child, but we're not stating it in a forensic court evaluations kind of a way.
Although we do get pulled into court and we do get asked.
But there's an ethical...
But that's exactly what we would go about saying. This is interpretive, right?
Right.
And explaining the nature of play therapy and how it works is really what you ultimately explain. It's not forensic. Right. And although play is used in forensic work, it's not play therapy treatment.
Right. They're not trying to help. They're trying to assess. in a way that is effective and non-harmful. But yeah, writing that line is hard. And there's a lot of therapists that work with kids that, in fact, anecdotally, I would say most therapists that work with kids don't understand that line because they haven't been trained, and, they want to help. If they think the kid has been abused, they want to do what they can do to protect that child. Yeah. But they don't understand, one, the ethical line and the professionality line, and also the legal line. Yeah. But also they don't understand their own bias, because we can believe things based on very little information that we've been influenced, and we'll state these things as fact when we have no idea. I wrote down a bunch of questions, and one of them is something that I would experience sometimes, where I'd be on the ground playing Lego with kids, because I love I don't know if you can see all the Lego stuff behind my head.
Oh, yes, there they are.
But, up all the way, can you see up there, or can you not see upstairs? Anyway, there's a lot of Lego in this office.
Oh, yes, I see. Uh-huh.
Yeah.
Okay, I mean, now I'm seeing it.
Yeah, they might look like models.
Yeah, at first I thought they were models, yeah.
But no, those are adult grown man Lego projects.
Good on you.
And I, as a therapist, would play Lego with kids, and I'm into it. And I'd be 40 minutes into the session, and I'd realize, oh crap, I'm a therapist. I'm not just playing with Lego with a kid. Like, I have to keep at least some attention on my clinical responsibility. And I feel guilty for having just indulged myself. Do you ever run into that?
That's your inner child, isn't it? And that's what we say as play therapists. We are the biggest toy in the room, first of all, right? We are there. So our inner child shows up. And that's the part where the training is so important, where we're coming in and how do we enter? Because there's so many pieces of ourselves, right? And that inner child is like, I'm ready, or I'm not ready, right? And so when Legos are on the floor for you, your inner child is like, let's go. So it's a matter of kind of checking yourself, like, okay, this is not me, right? This is my little here.
So it doesn't happen to you, like, very often to have that experience?
I will authentically enjoy my sessions with my clients. I will definitely say that. I do allow that authenticity because there is a connection. That bond is significant. That's part of the nature of human to human play therapy contact, is I am giving you a bit of myself, right? And some of our kids need that more than others. Some of them are like, show up and just be cool. And others are, I need to connect with you, Kimberly. I need to feel important. And when you're authentic with them. So yes, absolutely. Am I enjoying this? Definitely. I definitely want them to see I'm enjoying that. I want them to see a little bit of me, but all in context of, how does this serve my client? And so I'm trying to curate that experience of both being authentic, but also providing what they're looking for and they're needing. So if they're needing more connection, or maybe I have a singer and their nervous system regulates better when there's humming, I may use my voice and they say, wow, that is terrible singing, Kimberly. I'm like, that's okay. I'm still having fun with you. And I try to curate that for them, right? So I'm using a bit of my own authentic self, but specifically for them. And that's kind of the balance that I look for. Mm-hmm.
Yeah, other anecdotes, like there was a brother-sister client that I worked with, and in session over time, I found that the freest that they were in session is if we played fairly rambunctiously, with throwing things in my tiny little office that I worked in at an agency in my early career. And there we'd get tables and put them on their side for like barriers, and we'd be throwing like Nerf and stuffed animal stuff at each other, and laughing. And so do you ever do stuff like that?
100%. Play needs to be connected to what feels fun and playful for that child, right? It's intrinsically motivating. That's the beauty of play therapy. Of course, there's, again, different, schools of psychotherapy, different, models that we use that aren't child-led. However, we want this to be playful. And the definition of playful really is it's intrinsically motivating. It's something that they want to do. So yes, if you've got a rough and tumble, get ready. Do I come home with bruises sometimes? Yes.
Oh, really?
Yeah.
Like what would happen?
The foam sword just was too much, right? And it's like we're setting limits. But if there's not an opportunity in which to set the limit, they're not getting the opportunity to stretch where they need to stretch.
Yeah.
And so that is my
You can't make an
style.
omelet without breaking eggs, I guess.
There you go.
Yeah.
Unfortunately, sometimes that's me.
Yeah.
But that's part of the process, right? And it has to be meeting them where they're at.
Mm-hmm. Do you ever do it with families?
Yeah, sure.
What does that look like?
Depending on what we're doing. Sometimes I use TheraPlay, so it's very directed, very specific, all attachment-based types of activities that we do, very little toys, and lots of mommy or daddy, or sometimes I do both parents, but I usually do one-on-one. So that might look very different versus bringing the family in, and they're doing more of that child-centered, and I'm teaching the parents how to use that child-centered such that they can bring that home. So there's a number of different family therapy models that I'll use, but those are some examples of what that could look like. And I really enjoy having families come in and being able to develop some skills. And sometimes that really moves therapy along quite a bit faster. And sometimes I'll just bring in a parent, not as a regular family therapy session, but we'll bring them in and do some work, especially if a child feels a little stuck in an area and they have a really strong relationship with their parent. I find like that works really well. Or just hearing more from their parent in a way that I can, again, curate, and they're hearing some of the messages that they need to be hearing that they haven't quite heard from their parent. Because again, we're different ages. So sometimes our, tweens need to hear they're not the only one in the family that has anxiety. And being able to do that in a playful way, but still hear those messages can be helpful to augment the therapy.
Mm-hmm. So you mentioned attachment exercises.
Yeah.
What might that look like between one parent and one child?
So real fun. I usually have a mat, so it's comfy. And as long as parents' knees are feeling comfortable, we'll get down on the floor and they are sitting knees to knees, really, really close eye contact. And a lot of them just feel very young. They feel very playful. We might do special types of row your boat with the body and eye contact. So it's a lot of touching. That might be following directions in playful ways. So that might be hands up, hands to hands, almost touching and mirroring, following along. So they're learning to trust the parent and let the parent be in charge. So we're teaching some skills behind that through the attachment. But the attachment is, I can trust that this parent will lead me. I can trust that this parent's going to keep me safe. So we're keeping the parent in charge in these playful, very young feeling ways. We might do, one I like to do is telling the weather on their back. So laying on their stomach and, it's basically a baby massage is really what it is, but we're telling them a story. So again, they're feeling nurtured and reconnecting that nurturance that some of our kids didn't quite get.
You're telling them a story? What do you mean?
So like, I might, sprinkle on their back with my fingers lightly. The rain started today. And then the rain got heavier and I'm giving them stronger, right? And then it stopped. And so there's a lot of, it's kind of a massage story such that they're feeling more engaged because they're a little bit older than the babies that we would do these baby massages with. But a lot of it is reattaching some of that didn't feel like it quite connected for them, and for a lot of different reasons. And sometimes we're doing this with toddlers, which is a lot of where it originated from, is toddler work is where TheraPlay really came from. But you can do this with even tweens. You just adjust the style, but it's a lot of eye-to-eye contact, physical touch, and we do kind of 4 areas that they're developing the skills around.
So you could do this with families with kids that don't have any presenting problems. It could just be...
You just want to feel a stronger attachment, possibly.
Yeah, right.
Yeah, it can be, right, exactly. So sometimes, especially in my practice, which is the beauty of not feeling forced into a model, that you can really bring in families that don't meet medical necessity. Because aren't there so many things and so many times that you feel like you just need a little extra support, even though you're not quite, at this level? And I definitely enjoy those opportunities where families are like, this little piece feels like it's not quite where we want it to be. It's feeling like I'm not quite connecting with my kiddo, and I want to have a stronger relationship with them. I feel like I don't get them. Sometimes it's as simple as that. And beauty of these attachment-based work helps to reconnect that.
Do you ever, well, I mean, it sounds like you do. The way that I thought about it was, I'm only with the kid an hour a week at most. And the best case scenario, I can send the parents home as like therapists in a sense, in terms of how to approach the child 24/7.
Right.
So that they can do so much more accelerated work with the child, and it will hopefully displace whatever was going on in terms of the problem to begin with, right? So I sometimes would shift my approach to, well, okay, I have 3 months. I'm not going to get that far with this kid. I'm not going to cure them in this time. But I can really set up the parents for the long-term curative process. And so I will, in a sense, entertain the parents' notions by paying attention to the kid, but really I'm paying attention to the parents. And I might be explicit. I might even literally just tell them that. But if they're resistant to that, I'll be trying to influence the parents and show them by example and reward things, like with PCIT, parent-child interaction therapy. And I'm trying to, push the parents in a direction so that 24/7 and into the future, beyond the 3 months that I have with this family, then the child will be better off. Do you ever think along those lines?
Yes. I mean, that was a lot. So I'm trying to track all of those lines. But ultimately, yes, we are, trying to get the parents at a spot where they feel confident in being able to manage the hard things, right? So definitely, we're trying to train and teach them. There are co-therapists. Sometimes I say to them, you're the ones doing the hard work, they have the application, right? I'm training, teaching them in these different ways, using different models, the new coping skills, the new strategies, the new ways of thinking. We're creating new neural pathways in our play therapy. Now it's the application, and that's the hard part. That's the parents, the teachers, the coaches, everyone that's working with them on the day in and day out. So we want them to feel capable, and that takes time. One, to understand and learn. So, we're providing a lot of psychoeducation, as well as these hand-based, skills for them to implement with their children. So yes, in that sense, that we do want them to feel like they've got what they need, especially if we have a short term. But that's why we want to start from the beginning, getting them ready to end, right? We want them to be a part of the process. I do a lot of check-ins on, how are these strategies working, not how do we want to tweak them. Research shows the more involved parents are, the better the outcomes. And that's exactly why, right? Because they're doing a lot of the extra work to support the changes that the child is trying to make. Yeah.
I, as a marriage and family therapist, am oriented that way and would supervise and teach that way. And I never understood how any clinician who worked with kids could approach the situation without heavily, at least attempting to involve the parents.
Yeah.
And I would see some therapists that would reject the parents. They wouldn't want the influence of it. Right. And sometimes there's a place for that, of course, but generally speaking, the kinds of things that are brought to our offices, I find ridiculous that you could think you could help without talking to particularly the parents, and if not the entire system. I mean, as a family therapist, I might have grandparents and cousins and siblings, and in my tiny little office, and that would. So, switching topics.
Okay.
There's a lot of new play implements for kids today that weren't around before, like with Lego. I grew up with Lego, but if I were a kid today, I would be on Minecraft a lot because that's the video game version of Lego, right?
Really
and is infinitely more. There's infinitely more possibilities. You don't have to rely on
Yeah.
expensive Lego sets. You could just, do whatever you want to within Minecraft. It's just an endless playground, and you can interact with other people. So I have done that kind of work with kids, and I've also had people on the podcast talking about. Also, we had a lot of episodes about using Dungeons and Dragons in tabletop role-playing game in group format.
Yes.
And I was on the board of a nonprofit called Game to Grow, and they're a big organization here in the Seattle area with Adam that do that kind of work. So do you see anything along those lines in terms of what the kids are wanting to do and what they respond to? What's your experience with that?
Yes. I think as far as my experience with that, yes, kids will come in, they want to talk about it. They want to talk about their world, so they may want to come in and tell you all about Minecraft. And then you've got kids that want to play out Minecraft without the video itself. So we do, role play, if you will. That's probably the best phrase for it. Let's start building, so absolutely it's incorporated. Sometimes they incorporate concepts of their video games into their play, right? Some parents might say, oh, that looks just like the video game. I see what the video game is. And then I try to help them understand, this is part of the cognitive process. You're actually bringing all your world pieces together. So naturally, if they're playing video games all the time and then they have some difficulties with their friends, sometimes their play might mix those two together, right? They're using concepts from all the different areas that they're learning. This is development. So I try to help parents also understand that they're not always just playing out the video game, even though you see a lot of the concepts of the video game in the play. Understanding the video game is helpful because then you understand, and sometimes if you're a good video game person. It's not me, sorry, but you might be great at that to be able to say, oh yes, Zelda, I know exactly what you're talking about. And sometimes they help me out, but the meaning behind them still has and plays a role in interpreting and understanding them. And so it's not necessarily just the video game. And it could be Disneyland for that example, all the Disney shows, and right, this is part of their world. But just because you see some of that doesn't mean it's the actual story. And why did they choose that particular one? Why is that significant to them? All of those are meaningful for them. That's one aspect of being able to answer your question.
Yeah. So the trends of Disney characters, for example, 5-10 years ago, it was probably all Elsa and Frozen, right? What's the current trend right now?
Often what I try to do, and this is because I want my playroom to be a clinical playroom. So I work hardest, and this is what we do in general in creating a clinical playroom, is we take out those characters. So we want kind of these non-brand, nondescript items. Do I have some? Yes, I do have the Spider-Man, the Batman, the Elsa. We do have some of those, figurines and some of those characters, but those are far and few between by intention, because again, we want these stories to be natural, right? We want them to come from this. So if I have too many characters that are reminding them of the story, it almost is like a recommendation, if you will. It's almost like
it locks them in, maybe.
Yeah,
kind
absolutely.
of routes their play in the story of the movie,
right,
rather than it coming from within.
Yes. So I try to navigate around that. Do they come up? Yes. Do they want to talk about some of the most current video games, Disney, whatever it might be? Yes. Great, helpful. And if it's a show I haven't seen, what's important about that show? What, right? Because it's real. That's the significance for me clinically behind it, is not so much what was all of the story, but why was this significant to them?
Right.
Because it's a value there.
Exactly. Why did it even emerge for
Yes.
them? There's a lot of stories that, one, they would have been able to talk about in session, but also, why did they notice it?
Yes.
Why did it register with them?
Exactly.
And really all of us. Do you ever use the techniques on yourself? Like you think, oh, I need X, Y, and Z play right now to just unwind
Oh,
or
yeah.
process
Absolutely.
or something. Like what do you do?
Yeah. Some of those are really somatic and nervous system related, right? I will do that through the day too, in between my sessions, right? I've got a trampoline in my room. Sometimes I will do some jumps, right? Great, easy nervous system reset, especially after something that might have been really intense. I want to be ready for the next person. And so I will do these, regulating pieces for myself that are very enjoyable and kind of reset myself. So
what are
that's
some
a
other
fun
tips
one.
like that, like trampoline? What are some things that people can do to experiment with their own somatic, regulatory, nervous system efforts? What can people do?
They're really like micro breaks, aren't they? So these little micro breaks that we get that are a minute to 5 minutes, incorporating those are such a valuable reset. So for me in my office, I have a really beautiful couple of trees, one really close and one I can see the tops of because I'm in the city. So I'm a nature-oriented person. Nature is just a natural reset, right, for our nervous system. So I will just look out, or sometimes I also get to step outside for a couple of minutes and just deep breathe, notice, pay attention. What does it look like? That's a really quick, easy reset, right? So little simple things. Again, I love my trampoline one. Sometimes I do the sand. So I've got my big sand tray and cleaning up the sand tray because it's very popular. Then I just smooth out the sand. And so touching it again, just that micro moment of smoothing out the sand, feeling the sand, allowing myself to notice it sensory wise, experience that, notice the coolness. So those simple little micro breaks just kind of reset me, reground myself, and just kind of literally or figuratively, depending on the one, shake off, some of that intensity.
Mm-hmm. One of our very first episodes, maybe the fifth episode we ever did on this podcast in 2008, 16 years ago, was on sand tray therapy. A supervisee of mine did that work. I didn't know much about it, so she taught me a lot about it. And she had the sand tray, and she was Jungian, so she had all these archetypal toys, and she had a particular spot for every single figure that was meticulously organized on these shelves in her office. Do you do that with your toys, or do you just have
to a large degree? Yes.
Okay,
to a large degree, yes.
So you're very particular. Okay, well, that's where the Batman goes, and
I've got my littles, and we move through the day pretty quickly. So as far as exact spot, no, but this shelf is all dragons. Or, the ice dragon doesn't have to be on the left, but this shelf is dragons.
Okay. Yeah. Yeah. Because, I don't know what principles you were following, but what Patrice was following was that she wanted the consistency for the clients.
Yes.
And she also wanted the predictability of where the thing, because some
100%.
people will come in and they want that ice dragon every time, and they don't.
Oh, yes.
And if it's not there, or if it's in the wrong place,
yes.
it can be very upsetting to
them.
Yes.
Yeah. You've got it.
You're right. So just the last couple questions.
Sure.
You mentioned child-centered play therapy, which is a pretty easy thing to teach, but hard to really embody because it's such a different way of approaching life.
Yes.
And if I might take a shot at it, and you can tell me if this is off or not, because you can do this as a parent, as a teacher, you enter a space for yourself, energetically wise, and also your own mindset to be centered on the child's direction. You don't try to, within reason, if the kid, wants to play with a knife or something, there's certain guardrails, but generally speaking, as long as there's nothing like that going on, you are focused on where the child wants to go, and you're only interacting in a way that encourages or enhances the direction that they were going to go. You're not inserting yourself into it. And through this activity, which is emulative of person-centered therapy for Rogers, and which again can be simply explained, but it's incredibly philosophically difficult to do.
Agreed.
Because you have to be very phenomenological, and you have to adopt a mindset similar to like the Buddha, where you just completely like divorce yourself from your attachments and your own ideas and your fears and your agendas. We're such as Americans in particular, we're such like agenda like freaks. Everything, especially now with kids, it's like everything has to be like for a purpose, and there's like a schedule. Like, and you as a parent or a therapist or a teacher, you don't do this all the time, of course, if you're a parent, because there's other activities that need to be done. But if you're going to enter that space, it can be very enriching for a child. They can feel very heard. They can feel very, and they discover themselves. They feel attuned to. They feel like they have agency. There's guardrails. They don't have complete free. You're not going to take the keys of the car and drive away, but the experience, and we all know what that feels like. Hopefully. As an adult, when someone's really listening to us and they're not inserting their agenda, but they're present. They're not just like avoiding. They're with you, and they seem to be really empathizing and really with you, because children communicate and live in a play world. Then it's that. So is that an explanation?
I love it. I love it, Kirk. I love it. Yes. Okay. We want them to feel seen and heard and valued. And I think child-centered is a great model for that exact purpose. And there's a great connection that parents can have when they apply those skills. And it's something that children can also generalize from their therapy sessions with their therapist, this relationship, and it impact their other relationships in a similar way, right? Where they feel like their self-esteem goes up, right? It's like, wow, this person really paid attention and they didn't think it was stupid and they were interested. I think I got some great ideas, right? Like we want them to feel that.
Right. That's the idea, is that through the 35 minutes of that in therapy, it generalizes to their personality such that they feel satisfied, a need is being met, but also they can feel like they can enact themselves at the outside world. A lot of the kids that come to us have been through a lot of abuse. So having this opportunity is very corrective for them. And then the way I described my approach to therapy, the way that I've always thought about it with kids, is that it's a combination of this phenomenological, child-centered play therapy, but also it has a lot of psychodynamic elements. Is that what you heard?
In your description?
Because you're integrative, so there's a lot of different elements in your work, but those are the two main. Yeah,
it does sound like you use a bit of psychoanalytic when you're interpreting. That's more of a psychoanalytic background where you're giving the interpretation for the parent. So you definitely are incorporating that. Okay. And then it sounds like you're also very child-centered where you're not asking questions. Like how my assessment techniques, I ask questions. That's not child-centered therapy. Okay. Because I'm asking questions, right? Right. But again, in my assessment, I'm doing that to see how are they responding. I may decide I have to do child-centered with this after my assessment, right? I'm like, okay, that could be the case. But yes, absolutely. When we're not asking those questions, when we're really letting them show us and we're trying to understand and we're not really guiding as much in that way, but your reflections can also guide in a child-centered way, right? You're kind of starting to move. You're maybe highlighting for them in a child-centered way still their capacity. So if they're feeling like it's low self-esteem and you're highlighting more by your choice of reflections and choosing what you're reflecting about as part of the therapeutic aspect, right? Versus time with mom and dad, which when it would be therapeutic, but it wouldn't be therapy, even though they may be using some of the same principles, which we do often teach parents how to apply these strategies at home. The therapy piece is really more of that knowing where to go, knowing where to guide without having to ask questions. And those reflections are guiding. And depending on your skill level of child-centered, you are interpreting during your sessions as well. And so that is also guiding in some way, but it's just being done in a non-directive way. Right.
So we've touched on certification and directions for clinicians. What could a parent do aside from going to a play therapist, which of course would be recommended in a lot of circumstances, but if they were to just generally learn parent skills of helpful play, where could they go?
If a parent doesn't have a clinical need, right? So they're not seeing their child anxious, they're not having a divorce, they're not struggling with task completion. If everything's going great and they just want to learn how to play, is that
Yeah.
what we're talking? Okay. Really, just parenting books would be enough, right? Because there's a lot of play-based parenting books. There's a lot of play-based podcasts. I mean, there's a lot of great information out there that are encouraging more play-based work. And this play-based aspect that's being integrated across allied health professions, right? We see it with speech therapists, occupational therapists. These are just a lot of availability, I think, in general for just increasing how to become playful. So I would look for, I don't have a specific one that I would recommend, but in general, these play-based parenting approaches, there are some great resources out there in general, and that would be sufficient. If they're not finding, again, any symptomatic challenges that they would want to seek out a therapist for and develop the skills, they just want to kind of be more playful, or how to incorporate that more, I think a parenting book that's play-based would be enough.
So final question.
Yeah.
What is it about you that attracted you to play therapy as a practice and as a specialty?
So I took my first play therapy course right before I entered my master's. So I did that, and I did that because I wanted to work with children and families, and I was already working with children and families at the time professionally before I entered in my master's program. And I was fascinated. Like, wow, this is my world. I'm less linguistic in my approach to life. It's not my first way of expressing myself is verbally. So finding a way to express, interpret, and communicate needs beyond words was exciting for me.
Well, what does that mean? So in your personal life,
Yeah.
are you expressing yourself through interpretive dance or so? Like, what is it that you're doing that's
You know
nonverbal?
what, Kirk? Yes. And to some degree, yes. To some degree, yes. I am. I'm much more physically expressive. I might communicate that. I'm a hands talker, right? Because that is just more me. I'd rather do things with less, like still having some language to express that, but beyond that, absolutely. And that may be, also enjoying and experiencing the world through symbolism and what that means.
So if people want to find you, they can go to evergreenplaytherapy.com. Is that
Yes.
correct? Or on Instagram at evergreen_play_therapy.
That's it.
And anything else you want people to know about you or about your group that might help people out?
Again, I think it's great when families have a higher need. I work with families very intensely. So families that feel like they need a little bit more coaching, a little bit more support than the traditional model of maybe, once a month or once every other month that they get to talk with their therapist. I do a lot more working with parents. And sometimes that means talking with the school every week because, they're having troubles at school so much. So really great when you're looking for someone that is going to work intensely with your family, I'd say would be something that might set me apart, aside from my credentialing and experience and training, but my approach in that way.
And you supervise other play therapists.
I have in the past. It is not my focus now.
Okay. All right. Well, thanks for coming on the podcast.
Thank you, Kirk.
Kimberly Bartlett, licensed clinical social worker and registered play therapist supervisor, if I'm understanding all the letters correctly.
Yes.
And everyone out there, please take care of yourself. Kimberly, why should people take care of themselves?
We need to, don't we? To keep living a great and healthy life. Let's do it.